Okay, okay.
Okay. You all ready there, Doc?
We're ready, baby. Let's go.
All right, let's go. We're going to get started right on time here, 6 o'clock. And because it's being recorded, anybody that comes on late will still be able to get the recording of the entire event. So we are here tonight with our Wednesday night webinar. I'm Joe Messino, and this our expert of the evening is, of course, the gut guy, Dr. Len Brancewicz. And Doc, this is going to be like a little nostalgia for you, isn't it? This is
Yeah,
bringing
this is
back bringing back some old times. Ask the pharmacist.
yeah,
Tell us tell us the history of that.
it's amazing. When I go back, God, 20 plus years ago, I had opened a medicine shop pharmacy, and there was the long and the short of it was there was a gal at a church we had just joined that was a representative for one of the local radio stations, and she had asked me if I could come up and help her put together a show called Ask the Doctor. And I said, I'd be glad to. I met her and we tried to do it. So we went out and interviewed 5 or 6 different doctors, and we had everything set up for a Wednesday. We were going live at 3 o'clock in the afternoon. And I drove into the radio station and we sat in the studio and we're waiting for this doctor. And it's 10 minutes, 5 minutes, 3 minutes before the show. The doc never showed. So
Mm.
at the last second, they changed it to Ask the Pharmacist.
Oh, I didn't know
So
that. I didn't know
I
that.
started, and the first question I got was, "Tell me about coenzyme Q10 for heart health." And it was like, um, coming from a very traditional side, it was like, you know what? I'm sort of lost here. Next question comes in. Tell me about how do you dose vitamin C? It's like, I'm expecting questions about pharmaceuticals, but
Yeah.
it went that way. So the show ended after an hour, and they got like all these people calling in saying, "We got to do this, we got to do this." So the long and the short of it was, I needed somebody to do it with me. So that's when I started shopping around all the
How
other
come you
medicine
didn't call
shops.
me, Doc?
I know. And that's where my partner Joe had a medicine shop. So we did it together, and we did it live every day, Monday through Friday in the afternoon, and every Saturday morning from 8 till 9 for 15 years. And we were syndicated on XM and Sirius, and we did that for almost 8 years.
Nice.
So it was
Nice.
pretty cool. It was nice
Yep.
at the time. It got a little bit overwhelming.
Hmm.
And the intriguing thing is, just last Thursday night, you and I were in Canton, Akron, putting together the pieces of a seminar on brain health.
Hmm.
And we worked on that presentation for a good long time. And it was like we walked into that room and it hit you at the same time it hit me. Len and Joe are back on the air, and we did it
Part
over again.
two.
So
Len and Joe, part two.
part two. So we did
Yep.
it. And we had a really good time in Canton and Akron, and had a great response from everybody about brain health. And that was intriguing. It really was. It was nice.
Yes. A lot of fun. A lot of fun. We've already gotten a lot of great feedback from that event in Ohio, and it's been the most so far. It's number one again, success in Ohio. So thanks, Kara, and everybody out there in Ohio. And they were really you were really well received, and we had a great time doing it. So here we are tonight. We're here for Ask the Pharmacist. We're bringing it back, little nostalgia, and I'm just gonna host the show, feed Doc all the questions, and let's see what we can come up with. We did get a lot of questions from everybody,
Yes, we
and
did.
we're gonna get through these first. And if after that, if there are more that come up, then we'll address those at the end. Okay?
Perfect.
Okay. So the first question we got, Doc, was that they would love some insight into clients that are placed on metformin for blood glucose or for PCOS symptoms, and how we could best bridge the gap and support the GI glucose utilization and regulation with this in play. They're seeing lots of terrible GI symptoms and very little glucose management. So that between that and PCOS, where do we go there, especially nutritionally, and not fall into this pharmaceutical trap?
You know, what's really intriguing, Joe, is when, as a pharmacist, when we dispensed metformin for many years, would open the bottle to count out the pills to give to somebody, and it had this strange smell like salmon.
Mm,
It smelled like fish. And it was amazing when we started to dispense it, the chemical structure of it is sulfur based. And we had individuals constantly complaining about gut issues. It was really tough to tolerate. Now, metformin can cause gastrointestinal problems by a couple different mechanisms. Okay. First of all, number one, it irritates the intestinal lining, it increases inflammation, and it increases gut motility. Okay.
mm,
But this is the key thing. Metformin alters the microbiome composition. It wipes out a certain percentage of your good bacteria in the gut just by its very nature. And
mm,
that's going to end up disrupting normal digestion. So somebody may tolerate metformin for a day or two, maybe
mm,
three, maybe a week, and then that'll start to creep in because now we've disrupted the microbiome. Now, metformin also increases the gallbladder's potential for producing bile. Okay. Now, we know bile, that's a yellow compound that helps with digestion, comes out of the liver, goes through the gallbladder into the stomach. And for those that don't have a gallbladder, all that bile ends up going into the colon.
mm,
Okay. So, first of all, you take metformin, makes more bile. Bile has nowhere to go into the stomach, it goes into the colon. Bile in the colon causes diarrhea.
mhm.
Okay, so the key rules of thumb that I have used forever, and I tell doctors this: if a patient does not have their gallbladder, I'd be very careful using metformin. I really would. So
Right.
those of you that don't have a gallbladder and on metformin, you need to have a discussion with your doctor. Number two,
Mm,
metformin inhibits glucose absorption in the small intestine. Okay. But what that does is it leads to, because of how it works, it leads to unabsorbed sugars floating around in the bowel.
mm,
And anytime there's unabsorbed sugars floating around in the bowel, the human body puts water into there and we get what's called osmotic diarrhea. Another big
mm,
problem. It
mm,
affects lactase metabolism. It makes it very difficult for a person using this to tolerate dairy. And
mm,
it stimulates GLP-1 release.
mm,
Okay, so we're talking about all the weight loss drugs. It actually stimulates GL1 glucagon like peptide 1 release, which again slows gastric emptying
mm,
and ends up causing nausea and bloating. So there's the problem. It's a problem by the very nature of the drug. Now,
mhm,
let me say this, and Joe, I'm going to ask you to chime in on this because of the new prep that just came out in the last couple of days called Sweet
mhm,
Balance.
mhm,
Um, you and I had a really good discussion about blood sugar control when we were up at the Ohio event. And we talked about some of the ways natural preps can support glucose management. That's a crucial factor. I'm going to go a little more into polycystic ovarian syndrome here in a second, PCOS, and I'll
mhm,
give you my protocol. So those of you that sent that question, just hang in there for a second. But Joe, when we looked at polycystic ovarian syndrome and higher than normal insulin levels, higher than normal blood sugar levels, we said, okay, you can start with a prep called Glucolyze.
mhm,
It's a great prep. It's got the great combination, especially the right form of chromium that's in there, and how that can start in the initial stages to get the blood sugar under control. Now, there's two more, I hate to use them, weapons, two more
mm,
guns in the holster that are helpful here. And Joe, can you go through those two? I want to talk about Nutraglutide
mhm.
and then brand new, hot off the presses, the new Sweet Balance Prep.
Glucolize, as you mentioned, has always been our go-to, our foundation formula for just managing blood sugar. And the reason it does so well is, like you said, it has the foundation in it. It has the proper amount of chromium, and it's an albion chromium. But and people, I think, don't give enough credit to these trace minerals and their job in our body. And, when you lose a trace mineral, it's small to begin with, it's going to go first, it's not in the soil anymore. These deficiencies always lead to a condition. We've been saying for years, deficiencies and toxicities lead to these conditions. Well, a deficiency of chromium can lead to an imbalanced blood sugar because it won't allow, the cell won't open up to allow the insulin to get the glucose in there to be utilized in the mitochondria, in the furnace. So we have, that plus the proper amount of cinnamon. The studies were done on cinnamon, and the minimum amount to get a positive effect on blood sugar was 1 gram of cinnamon per day. So we get that in glucose. There's other formulas with cinnamon, but if they don't have that amount, there's no guarantee you're going to get the effect. The
Mhm.
studies show an effect at a minimum of 1 gram. So this has been a very successful formula for us. The reason we came out with Nutraglutide was because there's a bigger problem, and that's metabolic syndrome. Metabolic syndrome, as it started out as Syndrome X, we've known this for many, many, many years. You and I worked with one of the best in metabolic syndrome, Jim Laval, for many
Right.
years. And metabolic syndrome goes beyond insulin resistance. Now you have four factors. You have insulin resistance, you have hypertension, you have hypercholesterolemia or high fats in the blood, and you have obesity. And
Think
so,
about that, Joe. I don't mean to interrupt you there,
yeah.
but when you gave those 4 points, the 4 points that surround that X, when they call
Hmm.
it Syndrome X,
Right.
and you see how many people in America have hypertension, start number one, high blood pressure. Number two, have high cholesterol, whether they're on a statin or they're controlling it some other way.
Right.
They have abdominal girth, put
Hmm.
on weight. So all of those factors layer in that this syndrome X or metabolic syndrome probably affects, in the estimations are 2/3 of every American that's out there.
That's a lot of people.
It's a
That's a
lot of
lot
people.
of people.
Yeah.
And the problem, I think, Len, is that each one of those okay, in modern medicine, let's call it modern, not traditional. In modern medicine, they treat them all individually, separately, with a drug for this, a drug for that, a drug for this, a drug for that. They don't treat the body as a whole. And this is a whole body condition. And so, Nutraglutide, first formula I've seen to effectively address all 4 points of metabolic syndrome. It'll address insulin resistance, it'll address hypertension, it'll address obesity, which in the form of inflammation and high fat.
You
So,
realize, I hate to interrupt you again, Joe, but when you look at that, and one of the concepts by the staff at NF putting together that particular prep is not long ago, a year ago, you took
yes,
4 different preps
yeah.
to even start to control what you're talking about. To be
Hmm.
able to have one prep that could be taken once a day, 2 capsules once a day, that
Hmm.
can assist in blood pressure control, blood sugar control, insulin resistance, weight loss, go down the whole line. There's not many
Hmm.
preps like that out there.
Right. Yeah, it's very unique. It's very effective. We've had some great results with it. So then everyone, well, why in the world did we come out with Sweet Balance? Well, we came out with Sweet Balance for one very, very particular reason. First of all, Dahlia, the active ingredient, plant-based ingredient, has some very powerful studies behind it, very powerful studies, and they relate very specifically to hemoglobin A1C levels. And this is the gold standard, right? For
Mhm.
diabetes. You look at that 3-month snapshot of your blood sugar and you need it to be under 6.0. Now they're saying 5.7. So you've got people that are looking at their H1 hemoglobin A1C is at 7, 8, 9. We've seen 12. They're on a path to disaster. So this one is specifically for these people that have an A1C issue because not only is there Dahlia in there, patented research trademarked ingredient, but two patented forms of those trace minerals, chromium, vanadium. And remember back, Len, when those were the only two things we had to combat
That's
blood
right.
sugar, right?
Hmm.
Chromium and vanadium.
That was
So
it.
they're in there too to give it a three-pronged approach. But all three of these ingredients are patented, research, trademarked ingredients. So we're going to get the results because the
And
studies have been
they
published.
can be used together.
Yes, they
If,
can.
when you have somebody with a hemoglobin A1C above 7, I'd strongly recommend that.
Hmm.
Glucolyze a couple times a day, Nutraglutide 2 each morning, and Sweet Balance once a day in the morning. I
Hmm.
think that combination alone, understanding that hemoglobin A1C is how long it takes 3 months for a gram of sugar to attach properly to a red blood cell. So 3 months it takes. So that's measuring how all your red blood cells are going around just sucking up all that glucose that's sitting there so that it gives you a better indication of how your blood sugar control is or isn't.
Right.
Okay.
All
Now,
right. Go
let's
to
talk a
go to
little bit.
PCOS. Let's go to
Let's talk a little
PCOS.
bit about polycystic ovarian syndrome. Now, a lot of you are going to say, like, what's this have to do with me? They're estimating now that 50% of females past the age of 32 have this kind of an issue. Poly meaning many, cystic meaning cysts that are developing on their ovaries. Now, what do we see with that kind of a condition? Well, there's a lot of young ladies out there that go and have a horrible period once a month. They're just 3, 4, 5, 6, 7 days. They're just out of touch, and the cramping is so dramatic and the pain is tremendous. In a lot of cases, we just treat it with pain meds. So then we go in and say, like, well, what else is happening here? Well, if you come in and you do an ultrasound, color enhanced ultrasound of the ovaries of a polycystic ovarian syndrome patient, what used to be red tissue, blood rich, has turned blue. The extension of the tissue itself on this outer surface of the ovaries has become so distended because of the polycysts that we ended up causing almost like a balloon effect on the ovaries. And they become extremely tender and painful. So every time during that course of the month that the period's going to start, of course, these things are going to be fried and really give you a lot of pain. Now, throw this into the category that birth rates in the United States are at an all-time low, not just in the last 5 years, 10 years, 20 years, all-time low. We're having more and more, I'm not going to call it sterility, I'm going to call lack of fertility.
Mm.
We don't have the capability of producing sufficient eggs or the quality of eggs, and we have young couples trying to conceive and they just can't do it. This is one of those contributing factors. So a young lady that has PCOS, I have a 10-point PCOS protocol. Number one, labs are necessary before beginning. You need a hemoglobin A1C. You need a fasting glucose. But here's a really important one that is missed by 9 out of 10 OB-GYNs. You need a fasting insulin level. Because unless we know how the insulin fasting relates to the blood glucose fasting, we're not going to know exactly how aggressively we have to treat it. Now, that's 50% of the scenario here. What tends to happen with those cysts on the ovaries is they have now become susceptible to insulin. Insulin should go to insulin receptors. But in this kind of case,
Mm.
insulin now is going to those receptor sites on the ovaries, causing more complication and
Mm.
blocking the correction that is normally done with estrogen. So what that does is bumps up testosterone levels and free testosterone levels. So
Okay.
what we find with young ladies with PCOS is abnormal hair growth, acne, and weight gain, which goes right along with it. So first of all, we got to get the labs. Number two, I use a lab called Diagnostics. This is just a little promotion to them. They're the only lab I know in the country that does this. It's a fertility lab. It does a 30-day cycle mapping, where for 30 days we take saliva samples and map out your entire cycle. Number three, we do a complete history of symptoms. Number four, if the hemoglobin A1C is higher than 6, you must start the three-pronged approach that we just talked about, the glucolyze, the nutraglutide, and the sweet balance. If insulin levels are higher than 10, we add thermogenesis into this prep as well. So we can utilize thermogenesis in here to help calm down insulin levels and the insulin demand. If total testosterone is elevated at all, we start estro cleanse twice a day for 60 days, then recheck. Estro cleanse has the capability of taking down total testosterone levels, which is 50% of the scenario in PCOS. If all three items are not positive, ultrasound, hemoglobin A1C, and testosterone, it's probably not PCOS. And I have had that over and over again where a young lady will come in and say, well, my blood sugars are up. How's your testosterone? It's normal. How's your insulin? They didn't check it. You probably don't have PCOS. If it's not PCOS, then we use the prep called fertility twice a day along with the estro cleanse. If only hemoglobin A1C is elevated, we use glucolyze, nutraglutide, and the new prep sweet balance. So that's the PCOS protocol. Most women know if they have it or not. Most of them have had a ultrasound of their ovaries so that they know what kind of issues they have every month. So hopefully that helps. I'll send this protocol over to Joe and we can get it up on the website.
Yep. Okay. Awesome. Very, very, very informative, Doc, as always. Now we got 14 more questions to get through. So
I gotta cut him a little short. You're giving me
yeah.
come on. Okay, I'll cut him a little short.
Okay. Some of them are a lot easier. That was very complicated and very thorough. All right. So from your perspective in practice, what are the 3 NF supplements that you believe everyone should be on and why? Feel free to include your favorite buffered vitamin C.
Amen to that.
There you go. That's a softball. There you go.
It's softball. Here, I'll go through this real quick because I got somebody that one of the emails I got saying, all right, you're 74 years old? Really? You and Joe's 70 years old? Really?
Yeah. Yeah. Really?
Something you guys
Damn
got to
right.
be doing is working. It's like really it's working. So somebody said well, what the heck are you taking? Well, the top 3 that I like, this is me. Buffered vitamin C, anywhere from 1 to 3 grams twice a day. Frontier Biotics, I use that more than any of the probiotics that are out there. I think it's a nice spread. It's not super high in concentration, and it can be used in a variable dose. I've used this for skin issues. I've used this for colon issues. I've used it for just upper reflux, a lot of different issues. That one has fit me to the T. And lastly, the third part is the ultimate shake. If I'm going to put one thing that I start virtually every single patient on, it's the ultimate shake. It gives you almost every food entity that you need, all of the different cofactors, just basically food to supply the nutrients that are necessary to keep you alive. So again, very, very easy to do. Now, one of the questions I had, Joe, I will share this with you. This is hush hush stuff. This is my stash. This is every day. Okay. I'm
Yeah.
just going to go through these really quick. Real quick, Adrenamax. I take 2 each morning. Adrenal functionality to me is a crucial fact of aging. Keeping the adrenals healthy. I also take an adrenal glandular once a day. So Adrenamax, my friend. Buffered vitamin C, I take 3 grams twice a day. The Frontier Biotics, every day. Now, sleep time every night. If you're not getting a good night's sleep, you're missing the boat. I personally like this immune glandular in a big way. I don't take this every night. I take it maybe 3 times a week to keep my immune system active. I cannot be one that's going to be getting ill in any which way. I like this prep probably better than any for joint health, the HA Plus. I have found this at a variable dose of 2 once a day or 2 twice a day to do an excellent job. Mag Complete, we're all deficient on magnesium. I'll take 2 or 3 of these a day. Nutraglutide, I take 2 each morning. Thermogenesis Complete, I take 3 each morning. and SPMs. I take 2 in the morning, 2 at night. So there's a lot of other adjuncts in here in this little box that I've done over the years, some things for uric acid, some other things, but that's the basic core. So I really think working with somebody and putting together a protocol like this can really help. It really
Mhm.
can. And it's helping me and it's helping Joe. So
Yep.
there's ways to put together a protocol that can be helpful.
Absolutely, absolutely. And with with the formulations that have all the different delivery methods available, it's really easy to take a lot of these formulations. So you didn't ask me, but I'm gonna give you my core four real quick.
Go ahead. Go
Okay,
ahead.
enter CoQ10. CoQ10
Mhm.
and DMG, 300 milligrams each, chewable tablet every day without fail, maybe twice. So anyway, yeah. So enter CoQ10, Probzyme, enzymes and probiotics every day, Super K2 every day. Get my K2 D3, CircuCore every day. And I'll probably add SPMs in there most of the time. So those are my core, other than other things that I'll take on a regular basis.
And it, and
All
again,
right.
it works. It works.
Yeah, it works. Question number three. Can you take SBC while pregnant?
Pregnant women should not take SPC. Okay.
Why?
Uh, issue being, it seems to be when the hormonal levels are up in pregnancy, where progesterone levels go extremely high, there's a tendency that the fungal component to Saccharomyces boulardii, it's a probiotic yeast, has the potential in pregnant women. This isn't in everybody because it's one of the safest probiotics for everyday use. But in pregnant women, it tends to cause the potential for a yeast infection. And depending on what trimester she's in, it could cause a mess in delivery.
Hmm.
So again, there are many. Frontier Biotics is my standard there. Most probiotics, almost every one other than SBC, are considered safe. We don't have to worry about absorption with the other ones, and we don't have to worry about any risk factors for yeast infections at all. So it's just
Okay.
there hasn't been any research done on SBC during the course of pregnancy.
All right. So Probzyme during pregnancy?
Probzymes,
Absolutely.
absolutely safe.
Yes.
Lactospore, that particular probiotic strain is amazing. And again, in the first trimester, when we're getting some of that morning sickness, talk about something that can really help dramatically. They taste good.
Yes.
Chew them, a little bit of water, a little bit of aloe vera juice, settle the stomach right down.
Perfect. Okay. What formulas do you recommend during pregnancy? Besides, we have a few listed here. Women's Complete, Omega 3D, Frontier Biotics, SPM, Super B Complete. All of the above, some of the above. Are we missing any?
The first thing I do for every pregnant couple is I do an MTHFR gene test.
Hmm.
I want to find out if they're methylating.
Okay.
That to me is the biggest risk factor for abnormal delivery, pre-delivery, early delivery, and birth defects. So in this case, Women's Complete has the methylated folate in it. It's covering me for 99% of the cases. If I do an MTHFR and I find out that we are not methylating properly, Joe, I'm coming in with some more methyl folate, and that's that B12 folate combo to try to put more of that into the system.
Okay.
Now, omega 3D versus SPM. No need to use them both. I personally would like SPMs better, a little more powerful, a little stronger so that I don't have to take as many. I think 2 a day on SPMs would be fine. Frontier Biotics, 2 a day would be fine. Super B Complete, if you're taking your Women's Complete properly, and this is what I say,
Mm.
2 for you, 2 for the baby. 2 for you, 2 for the baby. So if you're
Okay.
just trying to get pregnant, start on the Women's Complete, 2 for you. Once you get pregnant, 2 for you in the morning, 2 for the baby in the evening, and go to
I
4 a
like
day.
that.
And that will cover you. And then I would also strongly recommend doing progesterone levels. Um, so many young ladies having difficulties in hanging on through that first trimester. So
Hmm.
again, doing progesterone levels and the potential of using topical progesterone cream could be amazing.
Okay. Someone asked, what if there are multiples in the pregnancy? In other words, I guess they're asking,
Do we need to take more?
do we need to take more?
I would say probably not. The
Okay.
body compensates around that. So even if
Okay.
it's, if there's twins coming, I mean, the mom's going to notice more and eating more and supplementing, but I don't think you need to go any higher than the two for baby, two for mommy kind of thing.
Okay.
I think that's plenty.
Good. Perfect. Okay. So number five. We're down to number five. We're moving along here. How long should you take a digestive enzyme like NF-cybezyme or betazyme? Should you cycle on and off?
Excellent question.
Yes.
Betazyme is the friend that I recommend the most for anybody that's been at any point that has reflux, that's been on a PPI like Protonix or Prilosec or any of those, been on those. It's a tool that I've utilized many times when people have made the decision to get off of those acid blockers
Mm-hmm.
because betazyme helps to restore the proper acid level in the stomach. So,
Mm-hmm.
do you have to take it all the time? Should I cycle off and on? That's an excellent, excellent question. And typically with betazyme, I stick with that one by itself till I feel that reflux has been under control. Maybe I'll add a little Probezyme in for breakthrough if there's any reflux, using betazyme one or two before each meal, and do that 30 days, 60 days, 90 days. And if they start to say, hey, I'm doing really good now, I don't have any more reflux. All right, let's transition down to one before each meal and then transition over to Cybezymes.
Mm-hmm.
Cybezymes are the all-inclusive. It does more digestive support than just betazyme alone. So when we want to truly help the entire digestive system, Cybezymes could be used on a daily basis.
Mm-hmm.
I'll use it on a regular basis during that transition period, one or two before each meal. Then after a while, if I'm doing really well, I can just add it in with my bigger meals.
Mm-hmm.
If you're just going to do the shake a day club, you may not need it for breakfast, but you stick it
Mm-hmm.
in there with lunch. If you have some, toast or something that you're going to have for lunch, make sure you're able to digest it. And then again, taking it before dinner in the evening. And oftentimes, if we're having late night issues, I would probably recommend taking one Cybezyme before and again one after meals to try to get that food going through the system a little quicker so that you
Mm-hmm.
don't belch it up at all during the evening time.
Cybezyme is so complete that you may not know you have a sensitivity to a certain food. You may not know what that is. It could be certain plant fibers. It could be, anything from sugar to lactose to plants to the basics. So Cybezyme is so complete that it covers all of that in addition to proteins, carbs, and fats. And you're going to, you may not realize you need it until you try it. And then you're going to feel so much better after you eat.
Amen. Good
Okay.
question. Good
Okay.
questions.
Good questions. And a good answer, a good well-rounded answer to that is how long should you take a digestive enzyme? My go-to answer is how long do you plan on eating food in this country?
Yeah.
Right? Right? Because it's depleted of enzymes. Okay, next question. Why might some patients get gassy after taking Probezyme?
Good question. The most common answer to that question is a patient who is achlorhydric,
Mm,
somebody who had been taking acid blockers for a period of time where we really upset the digestive system, where the parietal cells in the stomach have lost track of the brain on how much hydrochloric acid we need to digest our food. So when I'm
mm,
achlorhydric, a probezyme, which is again looking at lactospore, will go down to the tissue. Now, lactospore typically helps to improve digestive health and has actually been documented to reduce gas and bloating by promoting a healthier microbiome. But again, if you're getting some severe gas after taking lactospore, it's not necessarily the probezymes. It's probably your system that's going to need a period of reconciling. So I would start again, slip backwards to betazyme for maybe a week or two,
Mm.
then try the Probzymes again.
Okay.
If that still didn't work and I'm still having difficulties, go to Cybezymes for a week or two, then come back to the Probzymes. A lot of times you just got to reset the communication from the stomach to the brain so that we don't run into excessive acid levels or under production of acid so that we can naturally take care of the gut. Now, and again, once we get beyond the initial stages of gassiness, Probzymes is actually used to break that down. So anytime
Hmm.
we would get gassy after maybe some Chinese food or something else, chewing one of those immediately goes down and dissipates the gas. So it works
Right.
really well.
Very well. Okay. Very good. All right. Number 7. Moving right along. If you are over 55, is it safe to take DHEA cream intermittently without testing your DHEA levels, or do you recommend daily for a month or longer and then test and see where your levels are?
The answer is yes. Um, DHEA has gotten a bad rap for a little while because it's an immediate precursor to testosterone. Um, what we have found recently, especially when we started digging in, Joe, once the topical DHEA cream became a new entity for NF,
Hmm.
we started looking into some of the research work that's been done and numerous studies on DHEA cream, not as a cosmetic cream, but just DHEA cream applied to a fatty area once a day on a regular basis helps with skin aging. Using DHEA cream once a day, male or female, can stop the dryness and the excessive dryness of skin. Now, here's a good one. Women who have vaginal atrophy postmenopausally, when sexual intercourse becomes extremely painful because of extreme dryness, DHEA, again, not vaginally, just topically to a fatty part of the tissue, can help renew vaginal health for a woman that's postmenopausal. So, do we
Hmm.
need to test it? The only testing concern that I would have at all, I've seen people on DHEA nonstop past the age of 55, and their levels do go relatively high. And if DHEA levels go relatively high, we sort of suppress the adrenal glands a bit because DHEA can also come out of the adrenal glands.
Hmm.
So, would I pulse it? If I'm over 55, I would probably do it 5 days on, 2 days off,
Hmm.
and let the body have 2 days to get back to some semblance of normality. And then I
And it's
would,
going to help stimulate the body's natural production of it, right?
exactly. And then I would every 6 months probably get a DHEA level done.
Hmm.
It's safe enough. Now, the blood work that you get done is called DHEAS. It's a sulfated form. It's not the most active, most accurate blood level. The best way to get DHEA levels is saliva testing. So again,
Yeah,
um, this new DHEA cream, Joe, let's just talk about that for a second. It was a new
sure.
addition to the topical line, and I think it has a great place.
Hmm. I do too, because it's transdermal. So, it's going to get through the skin into the bloodstream. And as you said, fatty areas or, underarms, forearms, you can, if you don't want to use your hands. I mean, I started to use it myself and I put it on my forearms and just rub it together on the insides of the forearms. That
Mhm.
way, because it's a pump, you don't have to dig into anything. You pump up with a calibrated amount, easy to use, very easy to use. So, and I think, Glenn, most if you're a man over 40, you probably have low DHEA levels.
Yeah,
Over 55, yeah, you're going to have lower
guaranteed.
levels. Absolutely. Okay, I had a client who read somewhere that the multivitamin has copper, iron, and that it shouldn't be used with vitamin C with someone who has cancer. Is this correct?
Copper, and usually what's in a multivitamin is a very small amount. Now, I will tell you this, that I've been using a colloidal copper extract with patients who are on chronic pain medication.
Mm-hmm.
Copper can actually balance the pain sensors in the brain.
Mm.
So again, you don't want to overdo it. Now, Cancer and copper and iron are typical in a lot of different multivitamins. Now, if you add vitamin C, and in most cases, we're talking about ascorbic acid. I'm not talking about buffered vitamin C. We're talking about ascorbic acid. Vitamin C works by lowering the pH. It makes you more acidic. When you become more acidic, the copper peptides become more stable. So the body's looking for that. But copper will oxidize the vitamin C, making it less effective as an antioxidant. And that oxidized form of vitamin C can actually expedite, even slightly, cancer issues. So the answer to this question is, and I had my arm behind my back saying, nah, I can't buy this, I can't buy this, I can't buy this. But again, if you're going to take the multivitamin with a lot of copper and iron on it, stick with that and hold off on the vitamin C. My recommendation would be look for a multivitamin that doesn't have copper and iron in it and add the vitamin C then, because the vitamin C in the battle of cancer is one of
Mm-hmm.
the most crucial factors. And again, getting a
Right.
buffered form. We want a buffered
Right.
form of calcium ascorbate, which can help the body's immune system stay active and strong to fight cancer.
Okay. This next question, um, boy, I'll tell you, I love this question because it kills me some of the answers you hear to it. But are there any supplements I should stop taking before surgery and or lab tests? I mean, I don't know. They're not the same. These are two different things. Let's address it separately. First, are there anything you should stop taking before surgery?
You know, the talk all the way around has always been, oh, fish oil is the bad boy.
Yes, right.
Fish oil, you know, you don't want to stop your fish oil.
Don't have any salmon before
Let me
surgery.
let me read this to you. You should generally discuss stopping fish oil with your doctor, as there is conflicting advice from healthcare professionals and ongoing research. This is new, Joe.
Hmm.
While some advise stopping fish oil 1 to 2 weeks before surgery due to a theoretical risk of increased bleeding, the most recent study that was done in April of this year by the American Heart Association suggested that fish oil will not increase the risk of bleeding during surgery. It could even reduce the need for blood transfusions.
Hallelujah.
So the healing
Finally.
time becomes even better. So you put the advanced
Finally.
HPD or the SPMs in there.
Yes.
And I remember talking to a couple different docs at Allegheny General Hospital in Pittsburgh when they were doing, when fish oil first came out. And a couple of the cardiologists went into this and they did their own study. And they went contrary to what the hospital was telling them. And they would go to their patients going in for open heart surgery and say, I want you to double or triple up on your fish oil 2 and 3 days prior to surgery. They
Mm,
said they bled
mm.
less, they
Ah,
healed twice as fast.
beautiful.
Yeah.
Ah, that's beautiful. Okay, Len, make sure that we get that study, okay?
Oh, yeah. Now,
Yeah.
the things you should watch, which you don't ever hear us recommend, Joe, St. John's wort.
Yeah,
No, you don't hear us talk about that.
right,
Kava kava. You don't hear us
right.
talk about that.
No.
Valerian, nah.
Mm,
Dong Quai. So we don't really, those are the ones that have had documentation to be a problem. Now, they also mention in here there are slight issues with melatonin. I have never seen that, and I looked it up, didn't see it anywhere.
mhm,
So I think you're really safe on most cases. Um, I think, the doctors tell you to stop everything. I don't think you should. I don't think it's
mhm,
really a good idea at all. And
mhm.
especially the fish oil, I would stick with it
Yeah.
all the way
And not
through.
only that, Doc, we also we have surgeons and someone you know very well, the neurosurgeon for the Steelers. Um, he's another Joe. But he was recommending years ago Power Fuel perioperative. He was using it not just, before, but before and after to help
Mhm.
with healing mitochondrial repair. So there are things that you're going to want to take more of, for prior to and after a surgery. What about lab tests?
There's part of me that says N-acetylcysteine can at certain points affect blood lab levels of kidney function numbers.
Hmm.
Nothing significant though.
Okay.
There's a lot of warnings that are now coming out about some of the lesser products. You'll find cinnamon showed up for a little bit, and none of which I think are of any concern. I mean, it's your everyday. If I want to know what your lab levels are today, I want to know what you're doing today.
Yes.
Just by
Right.
stopping something, that's not going to give me a true accurate reading of what the heck's going on in your system.
Hmm.
So I just prefer to keep them in there. I don't see that it causes any difficulties at all with blood
Okay.
labs.
Great. Okay. Here's one that's close to well, our hearts from our presentation in Ohio. How is NAD plus beneficial for brain health?
This is great. And I made some notes prior to us going up to Ohio. And I'm just going to go through these real quick.
Yeah.
NAD, which is nicotinamide adenine dinucleotide. And you may never have heard of that before. It's been around for a while. Back maybe 10 years ago, you saw a prep called NADH, which was a completely reduced form of this, which became a little bit of an in vogue supplement for a while. It
Hmm.
supposedly caused increased brain functionality, but it didn't work real well. Then NAD became popular and it started to be used in a lot of different clinics doing IV pushes on it. And people saw immediate responses. Short-term memory improved, brain functionality improved, uh, cognition improved, but it didn't last. So when we did the IV idea, we got about a 48 to 60 hour coverage from that IV. It was expensive, and then you'd have to come back and do it again. Thus came the dawn of NAD with a little plus sign in it. And that is a electron donator. Now, let me just say this. Joe, you know that when I was up there with you, in fact, I didn't really complain, but I was having problems with my rotator cuff. My shoulder was bothering me at a couple of different issues. When I went to the Pittsburgh airport to drop off my luggage, I stepped out of the car, right? Stepped out of the car. My left knee let go. I fell
Oh,
underneath the car
oh,
and I had an MCL tear.
oh,
Nice, huh?
Len.
So, needless to say, I had a limp through the Pittsburgh area. Joe dropped me off at the airport on Saturday, whatever day that was, Saturday. And it was like I dropped off my rental car and I had to walk through the airport struggling. But anyway, long story short, so today I went and had my knee looked at. I had therapy on my knee. It's much better. It's not a tear, it's just a bad strain. I had him work on my back, and the PT that worked on me, I had given 6 capsules of NAD plus. That's all I had left in my bottle. She said, tell me about NAD plus. So I said, here's 6 capsules, just take it. So she does a lot of in-house physical therapy. And so she says, I took one a day for 3 days. Didn't notice anything day one or day two. By day three, I ended up where I had an in-law that got ill. I went home 2 o'clock in the morning after I did all my rounds, couldn't sleep, decided I'm just going to stay up because I had to start seeing patients at 8 o'clock. I went to another day. She was up a total of almost 40 hours. Then she looked at herself and said, wait a minute. How did I do that? Okay. So then she said, okay, was that the NAD plus? She said, because my focus, my concentration, my feeling of well-being was so much better. So then she said, naturally, as a researcher, she stopped it. She took it 3 days, then stopped it, and immediately got drowsy, lack of focus, lack of concentration. And she said, will you please get me some more of that right away? Now, here's what NAD plus does. It plays a crucial role in the human body, every single person that's listening to this right now, by supporting brain function through multiple interconnected mechanisms. Number one, NAD plus is essential for what's called cellular respiration, particularly in the electron transport chain where it helps to convert nutrients into energy, ATP. The brain consumes about 20% of the body's total energy, despite only being 2% of body weight, making efficient energy production critical for cognition, memory, and overall neurological health. First thing that you will notice when you take this prep. Number 2, DNA repair and cellular maintenance. NAD plus serves as a cofactor for enzymes called PARPs, poly-ADP ribose polymerase, that repair DNA damage. One of the fellas on this call right now has been a patient of mine for many, many years. And before we went live today, told me that he just went to the doctor, is feeling okay, and the doctor did a workup on him and said over the last period of time, he had 4 little mini strokes. How do we go back in and do any potential repair to the brain post kind of mini strokes? And I said, I'm going to call him tomorrow, but one of the things that I would strongly recommend is NAD plus because of its cellular maintenance. Number 3, sirtuin activation. It activates sirtuins, a family of proteins that regulate cellular stress response, how your body responds to stress, how it helps to lower inflammation, and how it works for longevity pathways in the brain. Sirtuins help protect neurons from damage, regulate gene expression related to neuroprotection, and may influence memory consolidation and synaptic plasticity. What's that mean? It's going to fend off developing dementia and Alzheimer's. Mitochondrial functioning. Brain cells contain numerous mitochondria to meet their high energy demand. NAD plus is crucial for maintaining healthy mitochondrial functioning. And this one is really critical. Neurotransmitter synthesis. In a little while, we're going to talk about what we put together as a protocol for Parkinson's. Parkinson's is a disease of a lack of dopamine. It's one of your neurotransmitters. You have 16 different ones in the body. NAD participates in various metabolic pathways involved in producing all 16 of your neurotransmitters, which are essential for mood regulation, cognitive processing, and neural communication. As we age, NAD levels naturally decline, which may contribute to cognitive aging and increased susceptibility to neurodegenerative disease. You want to stop? Because if you've ever met somebody with Alzheimer's, you don't want to go there. You ever see somebody just sort of slipping a little bit? Maybe it's you. And the one test that I have everybody doing is I have them go out and get a novel, just something not scientific, it's just a novel, something that you can sit down in a chair and read and sort of escape. But then what I want somebody to do, you either set an alarm or have somebody interrupt you in the middle of a chapter. And I want you to get up, take care of what that issue is, and then come back to your book. Do you remember where you left off? I know you can mark the page, but do you have to go back 1 or 2 pages to get caught up because you forgot where you were? That's one of the signs that there's an early slippage going on. So again, NAD plus, one of the most powerful new introductions to supplements in the field of nutrition that I have seen anywhere. Joe, your comments on this? I think it's great.
Well, yeah, it used to be that, the only thing we ever had for sirtuin activation was resveratrol that we knew about. And then now we know that curcumin activates sirtuin. We know that green tea also does. And now we know that this blows them all away for activating sirtuin-1 genes. So to me, this is one of the biggest improvements in that category we've ever seen. And that leads us perfectly into the next question, which is our Parkinson's protocol. And have we updated it since or based on the research that we've had with Marla Turnbull, who is the person from Duquesne University and the Michael J. Fox Parkinson's Foundation. So have we modified our Parkinson's protocol, Doc?
I could see Marla on the screen here and she's smiling. We're in the process of it. Now, I'll go through what I had this thing done. All I did was add NAD plus to it.
Mm-hmm.
It's rather basic. Okay. First of all, and Marla and I came to the conclusion that I think it's still very important to not just accept what a doctor sends somebody to us for, who said, you have Parkinson's. I just had a young fella, 35 years old, who went to his doctor. He was having some issues, and the doctor said, you have Parkinson's. So I asked him, what kind of test did they do? Well, nothing. He made me pick up a spoonful of water and see if I could put it in my mouth. That's it.
Mm.
That's a diagnosis of Parkinson's. Yeah, and he started me on, at age 35, he started him on a dopamine prescription.
Mm.
And immediately he was having troubles with it. So first thing I like to do is determine dopamine levels. We have found a lab that can do from urine a very simple dopamine level. Now, I'm going to tell you this. Typically, we're looking at low levels. We did this on a young lady that we weren't having. This is during the study last year. We had a young lady on what I thought, and it just blew me away, a very, very high dose of Cinemet, the medication. And I told Marla that I was really concerned about that. And they said, well, let's just do her dopamine levels. Did. And the typical range, which went up to, I think, 300, her issues were over 1,000, I believe. So they were extremely high. So again, taking that back to the doctor, when we took her down to a lower dose of her medication, she actually did better. So determine dopamine levels, number one. Number two, review current labs. We had a big issue in every patient that we saw with cholesterol levels. And we had to turn our eyes away from that because we have found that cholesterol is a well-needed entity for brain functionality, especially in a Parkinson's patient. So over and above the cardiovascular risks, which I think are minimum, we need to maintain cholesterol levels in the low 220s, 230s. And again, part of what we did initially was write letters to doctors saying, would you mind during the course of this study that we get them off of their statin drug? And they immediately did better. Number three, we started them on NAD plus immediately. At least I do. That's my newest addition. Before I know too much about the patient, I'm just going to add NAD plus once a day and see what I can regenerate on a quick scale. Number four, if constipation is an issue, and most of those patients had constipation, I start what I lovingly call the Max Lax Challenge. Be careful. Do one a day, 3 times a week till we reset the bowel functionality. Max Lax is a very powerful laxative that can do an amazing job of resetting the clock. Number five, I use the results of the test to adjust medication dosage. Number six, we start Enter CoQ10. We'll start out with 1 twice a day and ramp up. And we've gone as high as 4 twice a day on that, going as high as necessary till we found that sweet spot where we start seeing the response.
And that Enter CoQ10 is 300 milligrams of CoQ10 per chewable plus 300 milligrams of DMG.
And we've gone as high as 8 of those a day on particular cases. So we've gone up to 2,400 milligrams, which was amazing.
Right.
Number 7, we started SPMs. I like to use SPMs. We can use the Astrate Omega HPD as well. And I did it at 2 twice a day. Number 8, we did sleep support. If they weren't sleeping, we gave them something for sleep. There was a lot of different options there. Number 9, a critical part of what we did was physical therapy. And we had a PT that came on and interviewed them and found out what their flexibility could be and what they were capable of doing. We weren't going to run them through the ringer, but we wanted to try to give them some typical steps under exercise physiology, which is number 10. God built you to move. We wanted to take them up and get them out of a chair and get them to move. And we can get them to move, we can assimilate the dopamine levels a lot better. And number 11 is that each and every time we talked to these people, we prayed for them because they felt abandoned. And most of the Parkinson's patients have a level of depression that's in there just because of all these situations. And we try to keep a smile on our faces each time and give them hope that if you can continue doing this during a 6-month period, we could see amazing changes. And again, when Marla put the numbers together and we did a quality of life study, which says on a scale of 0 to 10, 10 being really good, 0 being miserable, most of those patients started in the 2 to 3 range. And at the end of the 6-month period, they were all up about 8. That to me is astounding. And some of the results that we saw and the smiles on faces and the stability and the ability to get back into a family routine was just dramatic. So Marla's in the process of putting together all the notes, and we're working on Duquesne University as a sponsorship for the production of the results in the way of a study so that it can get out there for the world to find out. We don't want to keep this as a secret. We want to stand on top of a hill and scream from the highest mountain
Hmm.
that this is working.
Yep. Great. We've seen it work. We have videos on our website of it working, of these protocols working with Parkinson's patients. We have family members. I have a family member. It's been on the version of this protocol for 20 plus years. And to this day, if she walked into the room, you wouldn't know that she was diagnosed with Parkinson's 25 years ago. So they do work, folks. And in conjunction with their meds, of course, right? But they do work. These protocols make the difference. It's the Michael J. Fox Foundation. This poor guy, he has all the money in the world, but he got worse, 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 worse. I mean, to the point where he's, practically invalid at this point. So, what's the differentiator? The differentiator is the nutritional protocol.
Mhm.
That's the key. Okay, let's move on. How about what can a patient use to help with myositis or
That's
muscle
interesting.
inflammatory muscle disease?
Again, not one of the most common, but again, there are one, two, three, there's 5 different kinds of myositis. One called polymyositis, multiple muscle groups, weakness in the shoulders, hips, and thighs, develops gradually over weeks to months. Dermatomyositis, distinctive skin rashes, such as a purple rash on the eyelids, knuckles, elbows, and knees. Inclusion body myositis, the most common form for people over 50, muscle weakness and muscle wasting. It affects the fingers, wrists, quadricep muscles, and progresses slowly. Necrotizing myopathy, a severe form that can develop rapidly and cause significant muscle damage. And juvenile, occurs in children and shares features with the adult forms, but may have different patterns and outcomes. Now, what's behind this? What's causing this? And when you really look at it, we look at our own immune system. Okay. And if we take our own white blood cell immune system and break it into 2 pieces, on one side, we're going to call the beta cells. On the other side, we're going to call it the T cells. Beta cells typically are activated in the gut. It's about 80% of your white blood cells. In myositis, there seems to be a flaw linked to the potential of leaky gut syndrome, which is causing the beta cells to go off on a rampage by themselves and
Mm,
start an attack to the muscles. Now, the
mm,
body would typically have the capability, even though that's 80% of your white blood cells, you still got your 20%, which are called T cells, thymus mediated T cells. And what they have said, and the way it's being treated most oftenly, besides muscle relaxants and pain medication, is to accentuate T cell production. If we increase T cells, it counterbalances the beta cells and we stop some of the attack. Now, that gets me into the immune glandular prep, Joe, because in the immune glandular, this is a relatively new
mhm.
prep, we've got an extract, a glandular extract of a thymus gland
Yes.
from a cow that if you look at the research on glandulars, this has the capability of going to that thymus cell in the middle of your chest, small little walnut-sized gland that tends to deteriorate once we get older, and help it get back to normal so that I'm producing sufficient bold T cells. And if I make sufficient bold T cells, I can counterbalance the beta cells and start making a change in the muscle wasting. Now,
Mhm.
keeping in mind, the most common things we see with myositis is drooping eyes, esophageal problems, where the esophagus starts to compress. We have trouble swallowing, and the diaphragm, we lose breathing techniques. So this is not something that's super common, but it also is something that can basically put you down and out dramatically. So again, my point here, if you're diagnosed with that as an early age, seek counsel and look at something like the immune glandular. I think it's a fabulous prep for something like this.
Wow. That's really so insightful. I mean, and it does boil down to the immune system. And, when you look at something like this, it's very debilitating. And they, what would modern medicine look at this type of an approach?
Nope.
No, they would not. They would not. But again, getting to the cause and addressing that is first and foremost. Okay, we've got a few more here, Doc. We're moving along good. We get this quite a bit. What's your protocol for lupus?
Okay, that's a good one. I think we got to make sure everybody understands lupus is an autoimmune disease. The immune system attacks healthy tissues in the body. It's an inflammatory aspect that affects, this is really amazing, your skin, your hair, your brain, your joints, your organs, and your blood vessels. There's nothing else left.
Hmm. Hmm.
So this is one of those all-encompassing issues. Now,
So
because
both internal and external connective tissues.
you got it. Because symptoms come and go, many people don't realize they have an autoimmune thing going on. They may think they're simply sick with a virus. So again, there's a lot of blood work that can be done. Autoimmune disease experts have been helping patients, again, to identify lupus so that you can do things to calm things down. Traditional methods, traditional pharmaceuticals are immune suppressing drugs. Immune suppressing drugs. You see them advertised in all these commercials. If it's immune system, it's causing part of this, let's just kill it. Let's just wipe it out. And, when we don't have a sufficient immune system, lupus patients going on immune suppressing drugs run into a whole world of hurt. So again, the importance of addressing, this is a critical factor, is gut health. Gut health, gut health, gut health. Compelling patient case studies have shown that the majority of patients with lupus, fatigue, joint pain, unexplained fever, facial rash, hair loss, kidney problem, 90% of them have leaky gut syndrome, Joe. 90%,
Not
not 20 or
surprised.
30.
Not surprised, Doc. Yep.
The medical community at large doesn't know what causes lupus. Some claim it has to do with exposure to the sun, infections, or medications, but we still don't know. Now, here's the step-by-step. In order to put together a lupus protocol, the first thing we have to do is, can we identify if there's any toxicities in the body? Heavy metals, pesticides, pollutants. Testing, check it out. It's very common. About 50% of the patients have some underlying toxicity in their body. We have the preps available, Joe, that can be able to go in and do a pseudo chelation out of the body to take those remnants out of the body. Number two, deficiencies. In the majority of lupus patients, we have inadequate levels of vitamin D and B12. So typically, replenishing those can make a big deal. Number three, food allergies and sensitivities. Because leaky gut syndrome is a huge issue here, we're saying stay away from dairy, stay away from gluten. You've got to, at least until we get the situation under control, and we can do something to help the gut, if it is leaky gut syndrome, to try to be able to get it to where it needs to be. Now, here's the protocol I came up with, Joe.
Okay.
SPMs, 2 to 6 per day based on flare-ups. 2 a day on a regular ongoing basis. If I'm getting a flare-up, skin, tenderness in a muscle area, someplace in the face, I can up it all the way up to 6 per day to try to calm things down. HA plus. I like the fact that MSM and a lot of the ingredients that are in HA plus, 2 twice a day continually. That's my foundational prep for lupus. Vitamin D3, I use the Mega K2 Plus once a day to get to that 10,000 IUs of vitamin D. One of the most effective tools in lupus is turmeric. So I'd go with the straight turmeric prep, 2 in the morning, 1 in the PM.
Turmeric plus.
Yeah, then there's the add-on. Calm day if stress reduction is needed. Sleep time if sleep is needed. Again, get up and move and make sure you're adhering to an anti-inflammatory diet.
Okay. Awesome. Very okay. This is good stuff. Let's get down here to some nitty gritty. There's a good one. I'm going to skip up to this one. Uh, I'm going to come back to another one here in a minute. I want to kind of round this off, but how about this? What kind of protocol, doc, would you put together for someone dealing with hereditary hemochromatosis? How would they manage iron and hemoglobin levels without using blood thinners?
See, this is just folks, just so you know, this is like let's try to figure out what he doesn't know. And this is what again, hemochromatosis, iron overload.
Hmm.
What do you typically do? You go in and donate blood. They keep taking it. It's the Dracula disease.
Mm,
They take you in and they take a pint. They take a
mm.
pint.
How
Um,
often?
I've had people go in his office every 2 weeks. Some people go in
Wow.
once a month.
Mm,
So it's not easy to do. It's most common in type 1 hemochromatosis it is hereditary. You would know if another family member has it.
hmm.
Type 2 is juvenile. Type 3 is called transferrin receptor mutation. Now, what's that mean? The inability of the body to methylate and properly handle ferritin levels. So again, what I've done in cases like hemochromatosis, if we come with a definite diagnosis of this, I'd probably go really, Joe, I've gone as high as 15, I've gone as high as 30 milligrams of methylfolate.
Wow.
So I've gone extremely high, just trying to calm things down. And if I had to go that high to get rid of some of the symptoms, I do, and then I can back it back down. So again, one of those issues, it's not easy. There's not a lot you can do. But again, I think if we look at it from a gut standpoint and make sure that the gut is processing correctly, that the liver is staying healthy. So if I was going to do a protocol, I'd probably make sure I do an MTHFR test and dose properly the amount of methylated folate that I need in this. The potentials here, Joe, for the NRCoQ10 to enter this world as well.
Mm,
To again help to donate here. I'd
mm.
probably use GI Complete on a regular basis. Um, but again, and I would use Live Complete because the one place you don't want iron to accumulate that is going to take you down is the liver.
Okay.
So if we can keep the liver supportive, I think you have the best way of fighting this.
Would you add? I mean, just something came to my mind with Nattokin plus Nattokinase.
That would make a lot of sense.
Hmm.
Circulating around just to make sure it doesn't adhere any place in the body.
Hmm.
That's a really good idea. This is a rare one, and it's a
Yeah.
horrible place to be. But again, I think you can support around it and possibly get you to the point where you don't have to do the phlebotomy every 2 weeks. Could you
Hmm.
push it back to a month? Could you push it back to 2 months and watch the iron levels try to stabilize?
Okay, that was very
That was a
interesting.
good one.
Yeah, very good one. Okay, now here comes one of my favorites. You ready?
Yes.
How do you wean someone off of common scripts like statins, metformin, blood pressure meds, and antidepressants?
That's an entire course. Here, let me just say this. You do it carefully and you do it with a practitioner that's licensed to do it.
Hmm.
That's the first rule of thumb. You're
Right.
not going to go into somebody that doesn't have MD behind their name and ask them to take you off of a statin drug. I'll go back to what Marla and I did together is that when we saw a patient on a statin and we wanted them off the statin, we sent a note to the doctor saying, we're in the middle of this study. We're recommending that this patient stop the statin drug. Now, are there ways to control cholesterol other than statins? You're looking at somebody who has done research for the last 16 years on this subject because when I found out at age 39 that my cholesterol was through the roof, I was put on every statin that was out there. And I had sensitivities to each and every one of those. And I ended up having hospitalizations twice with seizure disorders twice, to the point where I was just finally in my records, I cannot take a statin drug. Now, if I don't take something, my cholesterol is going to go through the roof, even though I don't think it's going to cause me any harm. But I've been doing Reggie's rice. You look at Cholesto Red, a prep like that, that the research that's been done on the monocolins that are popular in that particular prep, just so you know, what is done to produce this supplement is that you get white rice at 58 degrees. Typically, it's grown in a mine shaft, a sterile mine shaft, and you usually have a 1.5 foot thick of white rice. You spray this monocolin, which is a fungal extract, on the white rice, and it takes anywhere from 6 to 8 weeks for it to propagate and go through the rice and turn the rice burgundy. Then they take the rice out, they dry it, they pulverize it, and they put it into capsules, and it's available. And it's a very powerful cholesterol lowering agent that works in the periphery. Where statins work on the liver, this is working everywhere else in the body. So this is going out, gobbling up lipids and helping the liver to excrete them off. So it can be done, needs to be done carefully. And again, first thing I would do is work with somebody that has the certification behind their name to be able to do that for you. Blood pressure medications, not easy, but it can be done. I mean, you could, and typically what I'll do is overlap a prep like 7 Flowers or deep ribose
Circucor.
preps. You know, there's Circucor. We can layer in a lot with whatever medications you're on. Make sure you're monitoring your blood pressure, seeing if we do get further drops in your blood pressure, and then slowly weaning you off of the medication, just making sure that the supplements are going to be enough to hold you. And it can be done.
Mm-hmm.
Same thing with the PPIs.
Mm-hmm.
That one in particular, when you're using Prilosec, you just don't want to stop that cold turkey. There's a huge rebound effect there. So typically we'll overlap with GI Complete or some of the digestive enzymes or IgG prep. There's a number of ways we can go to support the situation around that.
Mm-hmm.
Just do it carefully. That's all.
Okay. Yeah, I have another question here that I got real late from Mikey G from Len Lotto, and it has to do with low sodium. Can they're not, nothing outstanding in lifestyle, diet, or anything, but they're finding that two particular family members are experiencing low sodium levels, and is there something is there a kidney issue going on here? Is there something that, is it diet? Is it something that's, is it hydration? What, you have any thoughts on that?
That's a good question. Now, just so you know, in way of announcement, I went to one of the leading nephrologist, kidney specialist in the state of Florida today. I've been trying for a year to get in to see him because of my past kidney cancer. And you know how you sit on the edge all the time because you know you're doing the right things and you know you're controlling things, but you want another set of eyes on it. So he ran just a multitude of labs. And when I got the results back, and it was like, I looked at it and I said, this isn't perfect. This isn't perfect. I wanted it better. This isn't perfect. So I went in and saw him today for a good hour. And he said, what are you worrying about? He said, your numbers are good. He says, you're overlooking these things. He said, whatever you're doing, keep doing it because you don't have anything that's making you look like you're moving toward cancer again or kidney failure or dialysis or anything else. So hallelujah to that. I got the clean bill of health. But one of the
Good.
things that came up in the middle of that discussion was low sodium.
Huh.
I did not have low sodium, but the question came up. He says, do you believe this? He says, all these doctors are prescribing Morton salt tablets again.
Huh.
Because there's a whole grouping of people that are losing sodium. And I
Hmm.
said to him, is that a kidney issue? Which is the same question you just asked me.
Yes.
And he said, about 1/3 of the time.
Hmm.
He says this. The other third of the time, It's a magnesium deficiency.
Aha.
And what I tell people to do is start ramping up their mag. That's why I like that mag complete, because I
Mhm.
don't have to worry about bowel irregularities with it. Start ramping it up, ramping it up, ramping it up, and see if you can get your sodium levels to come back to normal. This is coming from one of the leading
Hmm.
nephrologists,
Yes.
magnesium levels.
Wow.
Now, we got one from Mike also on the same subject.
That's the one I'm talking about.
Yeah, and
Okay.
that patient was on a particular immune supportive called sulfasalazine.
Hmm.
Okay, it's a sulfa pill that lines the gut lining because
Hmm.
it tends to calm down an overactive immune system. It's an old first generation prep, but that particular prep causes the body to excrete off sodium.
Hmm.
So there was a two-pronged approach with that patient. They got to look at talking to the doctor about the potential of getting off that med.
Okay. I just got a question. Hi, Kat. She said, other than healing the gut and pulling food sensitivities, what would you recommend for Down syndrome?
Oh my.
Yes. Now, I'm assuming this is active Down syndrome situation. I don't know, Kat, is it kids? Is it adults?
Active versus prevention.
Right. I don't know. Can you prevent? Is
I wow.
active. She said active. Okay.
Here what I would think. I haven't
Okay.
looked this up, and I wouldn't take
18 years
anything we
old.
I
18
would
years old then.
I wouldn't say take anything that we say right now as gospel. I think give us a little time to do some research. But there's a part of me that says somebody out there has done research on NAD and glutathione
Mm,
in Downs patients
okay.
for stability, because
Mm,
what you've got is damage that's been done to certain parts of the brain. Now,
okay.
can you bring those parts of the brain back to life? That's a tough call. They're now saying that parts of the brain can reconstruct themselves. Could you beat Downs? I would doubt it, but could you make that patient with Downs be able to function at a different level, which is what I
Hmm.
would want to do.
Yeah.
I'd probably look at NAD plus. I'd probably look at SPMs,
Hmm.
you know, and even some of the what we just talked about up in Ohio, layering in purples, all the
Hmm.
different brain nutrients that we talked about, Joe.
Right.
I,
The
I can't
acetylcholine
see how,
stimulators.
I don't
This,
think any
right.
of that could hurt,
Yeah.
you
Right.
know, and it can only help, I would think. But I would think if they call us off
Oh,
air, Joe, we'll try to do some
sure.
digging in on that
Well,
NAD.
you had mentioned, neuro exercise. She's asking about neuro exercises. Well, that's one of the things you were talking about
Right.
uh, for early Alzheimer's and dementia is the neuro exercises as well.
Yeah, I just got one from Kara.
Okay.
You see this one from Kara?
No, I didn't see it. Go ahead.
How to provide care for COVID long haulers.
Ah, okay.
She said, I spoke with one of her clients today at DC.
Well,
He
yeah,
requested that we comment on it.
okay. Now, are we talking? I mean, this is a general term, COVID long haulers. I mean,
I know.
is it vaccine injury or is it long haulers from an infection?
It's yeah, you got to know that first.
Yeah.
But again, when I read this, I pulled out my protocol for long COVID treatment, and I said, why would it not hurt whatever form that long COVID thing is? But the long COVID treatment, if brain fog is the only issue going on, SPM 6 a day for 30 days.
Okay.
If sense of taste and smell have been damaged, probzymes, Joe, and we talked about this, 6 per day for 30 days.
In between meals.
Yes. Long COVID treatment, other than that, Nattokin plus
Hmm.
4 with each meal. I'm sorry, 4 on an empty stomach
Yes.
away from meals for 2 weeks, and then 2 per day for the remaining of the month. Circucore, bringing up your nitric oxide boost, 2 twice a day for 30 days. And remove complete 2 twice a day for 30 days or 4
Mm,
at bedtime.
okay.
And then the supportive treatment down the road, glutathione, liposomal,
Hmm.
oral Val, 1 daily for 10 days off 20 and repeat. NAD plus, 1 capsule twice a day for 30 days. So again, NAD plus
Yeah.
surfaces up as being a supportive for long COVID.
Hmm. So I got a comment from Dr. Carey. A big problem with Down syndrome kids is they won't swallow capsules. So what about liquid formulations, gummies, things like that?
Yeah. And
So
all those could be done. I mean,
yeah,
we could get you
well,
a
like you
powder
said,
form.
the purples, that's you could do that liquid. We have Noramax. Okay.
Got Enter CoQ10, which is a good
Yes,
chewable form.
chewable, and Noramax is a liquid. So
Yeah.
yes, those are
Yes,
some
it
great
can be done.
options.
There
Yes.
are options out there.
Okay. Well, I think we need to wind it down, Len. We're almost at the hour and a half mark.
Here's one. One more just came across, Dr.
Okay.
Curry. Any suggestions for hyperactive thyroid? Um, that's a very good question. And again, the typical thing that I do is I use that immune glandular. I want to stimulate the T cell productions to calm down the beta cell attack, very similar to lupus, which is happening to the thyroid gland, causing it to be hyper. The other thing is, if you can find it, there's an old homeopathic remedy called Lycopus, Lycopus. Been around for decades, specifically for hyperthyroidism. The last time I saw it was a company called Marco Pharma out of Utah.
Hmm.
And it's a liquid herbal. I can't remember everything that's in it, but I used to use it all the time for hyperthyroidism, and it brought the numbers back like in 30 to 60 days, the numbers just started to return to normal. So
Okay.
there is the possibility there if you can find lycopus. I think that and the immune glandular.
Okay. Yeah, I'll tell you, we have really hit a new level with these glandulars. Like
Mhm.
the immune glandular with spleen, thymus, lymph in it. I mean, you have three in one there. Powerful. You know, the glandulars from Dr. V's formulas,
Yep.
powerful, so we're really hitting new levels with these. And I encourage the practitioners, to start looking at that and experimenting there with those in some of these cases, because like receives like, and it makes a big, big, big difference in stimulating these processes in the body.
Hey, Joe, can we leave everybody with a food idea? I know
Sure,
you went for some classes with your granddaughter.
I did.
Tell me about that because I know you were all excited about going.
It was fun. We went to our local Italian restaurant. We learned how to make fresh mozzarella, and we learned how to make some authentic Neapolitan pizza and some homemade ravioli from scratch. So it was a lot of fun. Yeah, a lot of
All
fun.
right.
Yeah, guys, you got to cook, right? You got to make your own food. You can't trust what's out there all the time.
And I saw your corn on the cob challenge. That was pretty cool.
Absolutely. Well,
All right.
thanks,
It was
Len.
fun.
Hey, this was great. Wow, great questions, awesome answers, good
And we
protocols.
recorded this.
We
So
recorded it, so it's all there for everybody. Thanks everyone for attending. We appreciate it. Hey, don't forget, get in touch with your reps, because we got some amazing specials till the end of the month here. You got Jamie's birthday special, 25% off cases. We got buy six, get six on certain formulas, and the quarterly special as well. So lots of great things out there. Get in touch with your reps. Thank you so much, everybody, for
all right.
attending. And Len,
Have a good night,
I'm
man.
gonna leave with my signature farewell, and that is, keep an attitude of gratitude, and you will live long and prosper.
Amen.
Good
Take
night,
care.
everybody. Thank
Good
you.
night.
Good night.